Good evening. My name's Fiona Myint and I'm a council member for examinations at the Royal College of Surgeons of England, and I'd like to welcome you to this webinar on surgical examinations, one of our COVID-19 series. Next slide, please. I'd like to introduce my panel this evening. Professor Frank Smith, who is an old friend and he's also a vascular surgeon. He's the chair of ICBSE, which governs, if you like, the MRCS and DONES examination. And he's also been recently elected to become a council member to start next month. So welcome on board, Frank. We also have Burke, who's the president of ASIT, and Tricia Campbell, who's the president of BOTA. So that's our surgical side of things. And on screen, you will also see Dr. Alex Landau, who is our Director of Examinations at the Royal College of Surgeons of England, who's going to help me out in the difficult questions. So I need to declare that, of course, Alex and I are both representatives of the Royal College of Surgeons of England, and what we say is representative of the college, but the other speakers are invited guests, and what they say are their own comments, their own views, and are not necessarily Royal College policy or guidance. Please also note that this is an interesting webinar. Many of the other webinars have been very factually based. Examinations are a little bit up in the air at the moment, as you all know, and that's probably why many of you have tuned in today. And many of the things that are in process have not yet been confirmed. So whatever we say today, there's a possibility may change in the future or may be further developed in the future. Next slide, please. So throughout these updates, we've had a number of different topics, as you can see from this slide here, coming on to exams today. Hopefully that these have been fairly helpful. COVID has been an interesting situation for all of us. And please feel free to look these up on the website if you've missed any of them. They've all been really quite engaging. Thank you. Next slide, please. And any of you out there who are affiliate members of the college and about to take the MRCS examination with us, or anyone who's recently taken the MRCS exam and passed it and is about to join as a member, I'd be pleased to hear that we are launching our first 4 membership package, where in the first 4 years of your membership with our college, you will have a discounted fee, which is really exciting. And in the current climate, I'm sure that will be very welcome. Please feel free, if you're a current affiliate member, thinking about becoming an affiliate member, thinking about doing the exam, hopefully this will be very helpful to you. Next slide, please. So we're having this webinar because of COVID-19, the pandemic that has really changed how we practiced over the last 3 months. And as you may remember, at the beginning of the pandemic, the 4 Royal College presidents put out a statement saying that all college meetings, including examinations, will be postponed until the end of the summer if they were face-to-face. That's why we're now doing a webinar, and that's why many of our meetings have been done via Zoom or many other media. And the issues, of course, have been social distancing, difficulty travelling to centres, fear of a second peak, and in fact, many of us have been redeployed, both candidates and examiners, which has really messed up, if you like, the process. So this is where we are now. Next slide, please. So you may all know that on the June the 1st, the JCST put out a very useful document, and I do recommend that you read it with a lot of information on it. It included advice on ARCPs, on examinations, on training in the recovery phase, which we're now in, on national selection, which has recently passed, and on general well-being, OOPS, and various other things. So I'd recommend that you go onto the JCST website and read that. Next slide, please. So on that document, there was a link to the derogations that have been made for examinations due to COVID-19. I want to briefly go through these with you now, because I suspect some of you may have questions about this. So if you're a current ST2 run-through trainee and you've not yet passed the MRCS because of the COVID-19 issues, you've been allowed to proceed to ST3, but you must pass the exam in the next academic year before proceeding to ST4. That, of course, includes gaining all your ST3 competencies as well. If you're not in run-through and you're a current CT2, and you've not passed the examination, then, and that's because of COVID-19, then you will be, in your ARCP will have been or will be issued with an outcome 10.1, where with on discussion with your TPD, you may be given extra time to take the examination, because it hasn't been your fault that you haven't had the opportunity to pass it, because clearly we all cancelled the last diet of the examination. If you're a current CT2 who's passed the MRCS but not yet met the core clinical requirements due to COVID-19, but feel that, or you and your TPD feel that these can be achieved in ST3, you can and may already have been appointed to ST3, but again, you must meet all those core requirements before progression to ST4, in addition to your ST3 requirements. If you're towards the end of your training and you're an ST6, and as we know that you cannot sit the FRCS exam, you can't apply for the FRCS exam until you have an outcome 1 in ST6 or ST5 for OMFS and neurology, but you've up until now made satisfactory progress, but not managed to gain the specialty requirements due to COVID-19, you can progress to ST7 with the agreement of your TPD and be allowed to sit the FRCS examination. And finally, if you're an ST8 or in an OMFS and neurology or an ST7, because their training program is shorter, you do need to pass the FRCS before you can gain your CCT. Can I have the next slide, please? So the ARCP outcomes that are new this year because of COVID-19 are the 10.1 and the 10.2. So the 10.1 allows progression where requirements are not met due to COVID-19. It also allows extra time at the end of core, as I've just said, and it allows entry to the FRCS for ST6 or ST5 for MFS and neurology. And the outcome 10.2 allows a trainee at the end of training to have extra time if you haven't met the curriculum requirements, including taking the FRCS exam. It's not your fault. It's not being given an outcome 3, it's being given an outcome 10.2. Can I have the next slide, please? So ICBSE, as you all know, manages for college level the MRCS and DONES examinations. And these are the principles behind the position that the ICBSE currently holds because of COVID. Because of social distancing, we have to have less candidates at the exam centres at any one time. Secondly, we will increase the number of days that we examine in order to try and accommodate as many candidates as possible in this socially distanced context. And finally, when we come to offer places, and this will happen sometime in July, to the next diet of the examination, we will give priority to those people who are in core surgical training currently. And that's because those trainees require the MRCS exam in order to progress. Thereafter, there are other criteria that we will use to place the next people in position, if you like, for those examinations. Okay, so if I can have the next slide, please. So the practicalities in terms, oh, someone's changed that slide. So the dates in terms of the examination are that the Part A exam for the MRCS will be held on 2 days, on the 15th and 16th of September nationally. And the exam will be different on both days, just so you know. For the MRCS Part B, we'll run it over a 2-week period from the 3rd to the 18th of October. And we are planning, certainly in the England exam, to run it over the weekend as well to increase the number of opportunities that people have to sit the examination. The DONES examination Part 1 will be held on the 14th of September and the DONES Part 2 on the 20th to 22nd of October inclusive. Some of you may have registered to take the international MRCS examination, but because we still don't know from the government whether we're allowed to travel or how long we can travel for or what the quarantine is going to be, etc., etc. This is as yet undetermined, and we will let you know as soon as we know when we can hold the examinations overseas. In the English College, we are penciling in dates, but nothing as yet is confirmed. Can I have the next slide, please? So in terms of the FRCS, as you all know, the JCIE is the overarching governor of that exam. The earliest FRCS Section 1 examination is intended to be resumed for the November diet. As yet, we've not been told what the capacity is likely to be. The Section 2 examinations that were previously advertised to take place in September, October, November have been cancelled, and in lieu of that, there is a plan to have an examination in November, and the reason for this is the venues will change because they're likely to be bigger venues with more space, greater opportunity for social distancing. But they've not yet published when and where this is going to be, and I understand that this will be mid-July. So I might ask Josh at the end of this talk whether he knows anything more, because he's a little bit more up to date than I am. There's likely to be possible contingency for a remote examination, and again, priority will be given to trainees who are nearing their CCT who need it to gain their CCT. And they have spoken about the possibility of resit examinations in the first half of 2021. Can I have the next slide, please? As you know, that as a college, we not only look after the surgical examinations, we look after the dental examinations as well. I might not necessarily go into every single one of these, but so the M-Orth, M-Endo, M-Perio and M-Prosa plan to run in September. It might be face-to-face, but it might also be remote. Watch this space in that sense, and we will let candidates know 8 weeks before how the examination is going to be delivered. Likewise, the DSCD, the DIP-IMP and the DDPH, they have months, dates, likely dates that they're going to run, and hopefully will be face-to-face, but also maybe run remotely. The MJDF and MFDS will run in October. The Part 1 will run in October. The MJDF November diet may not run. It's a very practical examination, but the MFDS Part 2 will run. And as you know, there is crossover in those two examinations, so you can take the MFDS Part 2 if you find that you cannot take the MJDF Part 2. And then for the licentiate examinations at the bottom, we won't be running the Part 1 and Part 2 LDS because it's a very practical examination, so we're unlikely to run that until next year. The DIP-OT will be run in September, we hope. It's a very small examination, so we should manage to run that face-to-face unless we have a huge influx of people suddenly wanting to take it. And the DHDT we expect to run in December. Have the next slide, please. So this is a slide with just the key contacts. The first 3 contacts are contacts for the English examinations. Obviously, the JCIE is an intercollegiate, very much an intercollegiate managed operation. So that will be the JCIE contact email. And if you have queries about the graduation ceremonies, because clearly we put those on hold as well, then RCS events will help you with that. Have the next slide, please. Okay, so that's the end of my little introductory spiel, I suppose. Perhaps I could start by asking the first question. Joss, can you give us a little update? I know you're a little bit more up to date on the JCIE and the FRCS exams. Is there anything you'd like to add there?
So I can't speak directly for JCIE, but in conversation with the chair over the last few days, Tricia and I have been told that purposefully there are sort of 3 scenarios which are being planned for, with any changes to any of the examinations requiring GMC approval. Purposefully, there is the hope that in the November sitting, if the situation allows, that all people who would plan to take the FRCS will be accommodated in bigger venues, as you've said, Fiona. An intermediary between that and going to a completely virtual scenario, which is a possibility, would be a hybrid model where some elements would be done face-to-face and other elements would be done virtually, potentially separated in time in terms of sitting those components. But again, this is all very preliminary, hasn't been confirmed, and are essentially contingency plans if we need to go to that stage, and a thought's being had just in case we need to move quickly if the government stance changes.
Thank you very much. And Professor Smith, can I ask you, as chair of ICBSE, what are you able to tell us about potential contingency for the MRCS and DONES examinations?
Well, we have a group of representative of all 4 Royal Colleges who've been discussing this, and a series of discussions have taken place so far. And we also have to liaise with the GMC because the exam has to be fit for purpose from their point of view, and they have to allow it to go ahead. We've looked at a number of different contingencies, 5 or 6 different contingencies. And the 2 that we think are most likely are an exam in which mirrors the current examination, but in which there is likely to be social distancing still. And that is really common sense, I think, to everybody who's been watching the news over the last few months. We think that towards the end of the year, whether or not there's a secondary spike, we are still going to have to uphold principles of social distancing. So there's a possibility that we could hold an examination containing the elements of the current examination, but with the advent of social distancing, which, as we know, at the moment has come down to 1 meter, but we would have to take that into context at the time. And really the second possibility is that we hold a remote examination. If we do that, the remote examination will contain all the curriculum and syllabus of the current examination. It'll be the same exam to all intents purposes, and we're planning, in fact, even to try and keep the questions identical so that nobody will be disadvantaged if we have to go to a remote examination. The practicalities of how we do that and the exact content of the station still has to be determined. There's no doubt that for an OSCE, for a Part B examination, some of the things that we currently test in the OSCE are not likely to be feasible, either with remote distancing in a room where the candidate, the examiner, and perhaps a lay patient are, or an actor type patient, or indeed in the remote examination. So there will be some changes to how that is undertaken. We hope that we will provide quite adequate and explicit guidance to candidates prior to the examination, and that may, for instance, take place in the form of videos or indeed webinars for candidates similar to this, so that we have an explanatory phase. But one of those will happen, and we're planning to keep to the dates that have been advertised. I won't tell you exactly what the content of the examination is at this stage, because that's still ongoing. Similarly, the DONEs, we've had discussions about the DONEs, and DONEs feel that they're in the same position, but they're able to put it to a remote scenario if necessary. A lot of their stations are written actually as it takes place nowadays, and they will be able to transfer some of their OSCE type stations into a remote scenario if it comes to that. The bottom line is, I think that all 4 Royal Colleges are putting an awful lot of time and effort into trying to make sure that the applicants are not disadvantaged in any way, that we keep them and the potential staffing, the examiners, the examination staff, and any lay actors or patients safe. That's really important. And we realise there are anxieties about all of this, and we are doing our utmost to ensure that as we get information to pass on to candidates, that we can allay anxieties. So I hope that doesn't tell you very much about the examination if you're watching this and hoping I'm going to tell you what's in what stations. But the idea is that we're pulling together an exam that will be fair and equitable.
Thank you very much. And Tricia, can I just ask you, have you had many particular exam questions from your members in BOTA?
Yeah, I guess there's a general feeling of anxiety and worry, because I think it's a difficult time for trainees anyway, and then exams cause anxiety, and then put them two together, it's quite a stressful situation. But I just want to know, we've been saying how for the Part B, it will be a socially distant, but what does that mean for an exam, a socially distant exam?
For the Part B MRCS?
What does that look like?
Well, that's something that we have to work on, doesn't it? So at the moment, many people are looking at different venues with more space, and the timing might be slightly different, where you're not going from one patient exposure, for instance, to another. You might be going from one to a question where you have no exposure to anything, if that makes sense. But it's all still being looked at, but clearly it's something that has been taken on board. and has to be followed for the safety of the candidates, the examiners, and any patients or lay examiners that may be involved in the examination.
Does that mean that trainees will be expected to wear PPE throughout the exam?
If there's a station where they need to have PPE, they will have PPE. I'm pretty sure of that.
Okay.
Thank you. So I think we can open up to questions from the attendees on the webinar. I might ask, if you're going to ask a question about a particular examination, could you please state which examination you're referring to? So for instance, whether it's the MRCS or the DIPLs or whatever, so that we know which exam we can answer about. So Alex, do you have any questions for us?
Yeah, so the first question we have relates to the Part A examination, and I suppose it touches more generally on the principle of prioritization for candidates, and it's from a candidate who had their April examination sitting postponed and wonders whether there is a chance that they won't get a place in September.
I think that, I mean, as we've already said, the first priority will be to those who are currently in core training. Certainly from my point of view at the English College and Alex's point of view, I would then put people who have been cancelled in the recent diets as next in line for places. And I'm hopeful that we will be able to accommodate everybody. We will have to look at the numbers of people who actually put their application in.
And I think in terms of the point in time in which those places are allocated, so that the Part A closes at the beginning of July, so we'll be able to allocate places in the Part A relatively early on in the month, and the Part B closes later on in July, and then we'll start the process of allocation of places thereafter. But in either case, for all 4 colleges, it shouldn't be a particularly lengthy process based on the data we hold on candidates and their training status. So once the deadlines are passed for the 2 exams respectively, we should be able to confirm places relatively quickly. So there's a second question. So this is on the Part B this time. It says, are the Part B centres in Kuala Lumpur, Sharjah and Cairo open to non-trainees?
Yes, simple answer. Yes, so the overseas MRCS examinations for all colleges are open to non-trainees. What we don't know at the moment is whether or not those exams are going to run, or when and if, because of we don't know about travel restrictions. But if they run, they are open to non-trainees, yes, the overseas exams. I think that answers the question. Do you have another question, Alex?
Yeah, so actually there's quite a lot referring to those overseas Part B diets. So I'm just scrolling through to see. So in terms of the scheduling of the examinations, is the Part A likely to be held in September 2020 as per the schedule, and in a UK and overseas context?
Is the Part A MRCS, sorry, you went a bit fuzzy, I didn't quite hear you. Was it the Part A
so
MRCS?
is the Part A MRCS, are we committing to running that examination in September rather than looking to run it later in the year?
We are committing to run it on the 15th and 16th of September. That we are committing to. Is that right, Frank? Would you agree with that? That's across the 4 colleges, isn't it?
The discussion that we had today was that the heads of examination of all 4 colleges were keen to maintain the dates that they'd originally put out, and that is September 2020. Yeah.
Thank you. Is there another question, Alex?
Okay, I'm just scrolling through them. So this is a question regarding the FRCS. And again, Josh and Trish, I understand that you're going to have to speak on behalf of JSIE if you can. And it relates to whether there's going to be a further sitting of any of the diets later in the year in addition to the ones that are already advertised.
So as I said at the start, we can't really speak for the JSIE or the FRCS, but it's my understanding that the plan is to run a expanded in terms of capacity exam in November, try and accommodate all the trainees who should have sat in the cancelled examinations, running the examination in a format as close to as possible of what would be a normal FRCS exam.
Okay.
Yes, so I think in answer to that question, really, it is probably only one diet of the exam, probably for the different specialties, and not a second diet this year. is what we read into that.
And there's a follow-up question relating to the prioritisation, whether it's going to be done between the 4 colleges or whether it's going to be done through the college with which the candidate applied.
So there's a general agreement amongst the 4 colleges, as far as I understand, and Frank will correct me if I'm wrong, that trainees will take first priority, core trainees for the MRCS will take first priority. But then I suppose it may be open a little to interpretation for the 4 colleges as to what comes next, but the general agreement is that it's trainees first and then people who were cancelled. Frank, would you like to add anything or counter that?
I think we're trying to keep a unified approach across all the 4 colleges so that people, as I understand it so far, and Alex actually is head of examinations for the English College, there is an agreement between the colleges that there won't be disparity in how they approach prioritisation. In other words, all colleges will maintain the same prioritisation. And indeed, maybe Alex can comment on that, but my understanding is that there may be scope for the colleges to help each other out in terms of providing facilities for candidates to undertake the examinations. And we may even, in fact, for the first time, and I've been keen to promote unity between all the colleges, there may be an overlap of examiners from colleges. So depending on the availability and the presence of examiners, it's possible that you may be doing an English examination with an Edinburgh MRCS examiner, and vice versa. You may find an English examiner attending the Glasgow or the Irish examinations.
Yeah, that's right. And I think that there's going to be lots of the colleges are going to be doing in terms of collaborating more with one another in October, specifically for the Part B, to ensure that we can accommodate as many candidates as we can. So things like all running the same circuits on the same day. And as Frank said, ensuring that if one college happens to have capacity on any given day and another college is struggling to accommodate candidates on that day, in line with the prioritisation approach, then absolutely the colleges will be working with one another to make sure that we can get as many people through the examination as possible. So we've got a question here that's asking a bit more detail about progression to ST3. So what are the conditions to be allowed to progress to ST3 without the MRCS, quote unquote, because of COVID? What do we specifically mean by because of COVID?
So I think that is something that each trainee will have a discussion with their training program director about, because it will be hopefully fairly clear from the ARCP where the majority of the issues have been. So if it's been lack of access to experience and exposure to things that have clearly happened because of COVID-19, then that trainee should be allowed to progress, if all else being equal. But as we know, there's always sadly a few trainees who struggle anyway. And if it isn't, and if they've been struggling before COVID came, then the ARCP panel may decide that actually it's an outcome 3 rather than outcome 10. But you know, which is what would normally happen.
And there's one here for Professor Smith, specifically around that ICBSE intercollegiate position on prioritisation of candidates. Specifically, why should candidates who are not in core training not be offered a place?
Well, we've said at the moment, I think that's already been answered really along the way by the earlier discussion. We have an obligation to those who require this examination at the moment to progress their careers, and we have also an obligation to those who already put their names up for an examination that hasn't occurred, and have done the work for that examination. So the bottom line is we'll try and facilitate everybody who applies for the examination, but we have to be fair, and we have to keep the system moving. If there are candidates who are unable to take the examination but would have wished to and were in training, then that will gum up the system for those behind. And I think you have to accept that if you're stuck behind people who are already in the system, then that's not good for anybody, either the candidates who are being held up or the candidates who can't take their exams. So we will work on that, but there has to be some sort of preliminary prioritization, because we are now an exam behind already, and we have to make that up somehow.
Okay. So we have a question about the DONES Part 2. And given that this is a practical exam, is this still definitely going to be going ahead in Glasgow in October?
I can't speak for Glasgow because I only really look after the English exam, so I can't really answer that question. I don't know if anybody else knows the answer to that question.
I could give you an estimate. I'm not sure if it will take place in Glasgow. From what I heard in the discussions today, it's anticipated that 100 people or less are likely to apply to undertake the DONES Part 2. And the DONES team, the head and neck surgeons that are putting together that examination, will try to make sure that it's disseminated equally as they can do, but they also have to do that with respect to the number of examiners that will be available. And again, whether this is done at distance as a virtual examination, or whether it's done directly through a socially distanced face-to-face type examination.
Okay, and another question. Oh, sorry, go on, Fiona.
No, I just said thank you. Carry on.
Okay. So another question that I think is probably informed by that prioritization principle that's been spoken about already. Can UK candidates take the Part A at an international centre?
Yes. Yeah, they can. But it'd be on the same day. I suppose this would be for people who might be stranded elsewhere.
Or potentially that haven't been able to get a place in the Part A in the UK.
Yes, that does. They have to be careful about travel restrictions in that case.
And if I could just chip in, I mean, when we're examining abroad, we do sometimes see UK candidates who appear in the exams abroad. So that wouldn't be altogether unusual.
Okay, a slightly different take on that prioritization principle now. If for the MRCS Part B, if the candidate has been prioritized and is allocated a place to sit the exam in October 2020, can they opt not to sit in October and wait till the next diet?
I think any candidate, yeah, any candidate in any exam can opt not to sit an exam. Thank you, I butted in. Carry on.
No, not at all. I'd say yes, of course they can opt not to sit it if they feel they haven't prepared or they've been disadvantaged in their revision by COVID. It would be foolish to take an exam, any high stakes examination like one of these, if you didn't feel prepared along the way. So yes, you can. If you've been prioritized already for that examination, then, and I'm speaking off the cuff here, and again, I might be taken down by Dr. Landau and Miss Myint, but I think your prioritization would continue to exist. I wouldn't, for instance, think that you would then be disadvantaged in coming to apply for the next examination, but we have to see how long the need for prioritization continues to exist. The aim will be to get back to the first come first served system, really, where everybody gets a free crack at it as soon as they feel ready. And
can I just ask, can I ask Josh and Tricia, have you had feedback from the members of your two organisations in terms of whether we think that might be a likely course of action if trainees who were due to sit in the autumn and feel they've not been able to prepare adequately, or potentially wouldn't feel comfortable with you know, a refined format of the examination or a revised mode of delivery? Do you think there'll be people who, if they can sit, they might not want to?
I think questions there. The first one is, will candidates who initially applied and were hoping to sit in October wish not to do it anymore? I think the answer is possibly yes. Lots of trainees' situations have been very different. Some people have a really hard time in terms of workload. A lot of people have had, you know, potentially saddening life events over the last few months and may not feel in a position to sit it. In terms of the virtual nature, I think that's a different question, and one probably to pass back to Professor Smith in terms of if someone's applied for the exam, they've been given a place, and there's then a change to the format of the exam. Would that candidate then be able to withdraw, and under what terms would that be? And that's a difficult question to pick back on the spot.
Yes, that's something we hadn't considered. I mean, I think if we're going to say a candidate wishes to withdraw from an examination and they won't be disadvantaged, then it doesn't matter whether it's virtual or face-to-face. They have the option to withdraw from the examination. We're holding these examinations up as equitable, so the rules, governing prioritization and withdrawal should be equitable as well.
And Trish, you were going to answer that first question as well.
Yeah, I was just going to agree with what Josh was saying. I think that's the general feeling from trainees across the board.
Thank you.
So we have a question from a Part A candidate in core training who is asking whether there's scope for an extra diet in addition to the standard scheduled 3 per year to be held later in 2020, for example, in December. I suppose partly motivated by the fact that they've lost some chance within their training schedule to have their first go at the Part A. Will there be another opportunity for them to do so?
Okay, Frank, can I give that question to you, please?
Yes, I'm not sure I've entirely understood that. So, Alex, would you like to rephrase that very quickly?
I think the question is, will there be a 4th diet instead of just the 3 normal diets to give them an extra opportunity to?
I think it's unlikely. I think we are dealing with resources, and it's great being faced by a bunch of enthusiastic candidates. We're trying to find a bunch of equally enthusiastic examiners. We have to make sure that we have the adequate resources and enough examiners to carry that out. So I think it's unlikely that there'll be another diet this year, but into next year, into 2021, we will be trying to make sure that we deal with the backlog as quickly as possible. And that may mean extra days of examinations next year. And I'd almost pass that back to Alex, who has to deal with the logistics and sort all of this out. So maybe you'd just like to comment on that, Alex.
Yeah. I mean, it's partly due to the delivery logistics. It's also partly due to the generation of assessment material and how that assessment material is written, is blueprinted, is standard setting. So there are a number of considerations that we would need to factor into the prospect of having a further diet. So I don't think it's something that's necessarily planned at the moment, but I think we'll have a better idea about the sort of the backlog of candidates that we are facing between us as 4 colleges for both the Part A and the Part B once the deadlines close for both of those examinations. And I think if it looks like we're going to struggle to get candidates through either of those exams in good time, I think that we'll have to think about the possibility of further diets, I think.
Thank you.
So there's a question from a prospective Part A candidate in foundation training. Is it likely that candidates in foundation training will be allocated places in September?
I think we go by the same prioritization that we've already talked about. It'll be core trainees and people who are cancelled. And then if there's any spaces left over, then a foundation trainee will be given a place.
Sorry, I'm just scrolling down to find some more. So with the FRCS, I'm going to move on to that if I may. How will the content of the exam reflect the fact that trainees will not have seen as many elective orthopedic patients, brackets, much of the content, close brackets, for 6 months?
So the content of the exam can't change for the November diet. Any change to an exam has to go through the GMC, so that won't change.
So I suppose if you look at it from a dispassionate point of view there, you can't really sit the exam until you're ready. So the exam's the same, the standard's the same, and if you feel you need extra time because of COVID-19, then that's a discussion to be had with your TPD, because it's not your fault.
Are there any planned changes to the format of the first part of the FRCS?
I'm not aware of any. Josh and Tricia, are either of you aware of any?
No, so we had the discussions, because obviously the curriculum's due to change in August 2021, and the discussions about the format of the exam changing just to align with the curriculum, but nothing's been mentioned specifically about Part A, no.
Thank you. Alex?
Okay, so we've got an interesting question here from a candidate who's thinking about taking the Part A at an international centre. I'm wondering whether this would have an impact on taking the Part B in the UK and the overall impact on the qualification obtained.
Absolutely none. The Part A is the same wherever you take it. If we're talking about MRCS here, I assume, the Part A is the same wherever you take it, as is the Part B.
Okay, so I've got another FRCS question here. It relates to urology Part 2, but I don't know if that is necessarily material or not. But for those who are not in the training program, but planning to apply through CSER, would there be any preference to take the exams at the November 2020 diet?
I can't speak for the JCIE, but I suspect not. I suspect that people in the training program will be prioritised first, and likewise anyone who's previously been cancelled.
Okay. Can an ST6 in vascular surgery sit the examination in January 2021?
Do you mean the Part 1 FRCS?
I think so.
So an ST6 can sit the first part of the FRCS examination if they have an outcome 1 in ST6, or because of COVID, an outcome 10.1. Without either of those two outcomes, you will not be eligible to sit the examination as a trainee.
Okay. We've had quite a lot of questions around whether or not we can confirm that the international Part B examinations later in the year, so Cairo and Sharjah and Kuala Lumpur, will go ahead or not. I can say from an English college perspective that we simply don't know the answer to that question yet. It's very difficult to commit to the running of examinations when there are restrictions in place like quarantining and various other measures both in the UK and in some of the locations we'll be running those exams. We're working hard with the other colleges to try and identify a shared intercollegiate position on international examinations, but certainly for the MRCS, international exams activity is more collegiate than it is intercollegiate in the UK context. So it may be that different colleges will take different positions on that sort of activity, but we will confirm each case as an English college as soon as possible. Frank, would you like to say anything about the likelihood or the benefits of identifying an intercollegiate position on international exams activity?
I think the general feeling, and bear in mind that all 4 colleges have remote outposts, if you like, or outposts around the world, that they're all extremely well affiliated to. Everybody's keen to resume activity as soon as possible. We're still bound by conditions overseas. For instance, I happen to know that I examine in Malaysia some of the time, that there are still sort of features of their lockdown and their social distancing that would make it very hard to hold exams there at the moment. That's just an example. But the will is there to hold international examinations as soon as people can travel safely and as soon as the local regulations permit examinations to be held.
So there's a question here about candidates wishing to withdraw from the examination and whether they would be subject to the standard administration fee, 20% of their overall examination fee for withdrawing from the examination. this is the sort of thing I think we're going to take on a case-by-case basis. I think we're going to be more flexible about this sort of thing than we would normally be. That's one of the sort of the regulations that the colleges police relatively stringently for fairly obvious reasons around adherence to deadlines. But I think in this case, if individual candidates have specific circumstances that they think are pertinent to that decision, we can certainly consider that on a case-by-case basis. We've had a question asking whether we can just move back one slide. So Misha, can you do that?
That's forwards, backwards. Thank you.
Okay, so there's a question about whether candidates applying for the Part A in overseas centres may not be able to get a place in those centres due to a waiting list that's described or sort of local prioritisation protocols in place. I think I can probably answer that one and say that we don't think that will be the case. I think we use a network of international centres for our Part A exam delivery, and we expect to be able to accommodate those candidates. So there's a question about candidates who are in potentially sort of vulnerable groups, so those who might be shielding or those who are heavily pregnant at the time of their scheduled examination. Are there likely to be options for those that are unable rather than unwilling to travel for any face-to-face exam element, either MRCS or FRCS?
Frank, is there any arrangements across the colleges for that?
There's not a formal arrangement yet, but it's certainly under discussion. We recognise that there are more vulnerable groups, and there are a number of vulnerable groups. And as Alex has already indicated, on a case-by-case basis, I think we would have to deal with those, and there would be a certain amount of sympathy and empathy with candidates who felt that they weren't able to undertake the examination on that basis. What we're going to be able to put into place at the moment hasn't been decided, but we're certainly considering that aspect. It's not gone ignored.
Thank you.
Okay, so we've got a few questions about the LDS Part 2, so that's the licensing dental exam for overseas qualified dentists, asking whether we'll be running any international exam centres for that exam. I can say that the answer to that is no. All of those exams are run in the UK. Will there be any extension of places or expansion of places for the next LDS Part 2 examination? We will certainly try and accommodate as many candidates as we can, but there are specific elements of that examination. So the dental mannequin component that requires the assessment of practical skills means that we have quite a fixed ceiling of candidates that we can examine based on the number of spaces that we have at the hospital accommodation we use for that part of the examination. So it's unlikely we'll be able to expand the number of places considerably, but we'll certainly aim to run as effective a schedule for that examination as possible. So this was covered, I think, a little bit earlier, but there's a question regarding timeframes for allocation of places following the deadline for the MRCS Part A and the MRCS Part B applicants.
So what exactly is the question?
So how long do we think it will take to identify whether candidates will have a place or not for those two examinations respectively following the passing of each deadline?
Fairly quickly, I think is the answer. We'll turn it around as quickly as possible, matter of weeks, correct?
Okay, so this is an interesting one regarding regulatory approval of any changes that we might make to the MRCS Part B. So in the case of remote examinations specifically, can we confirm that the GMC will accept the standards of those examinations and that they will be taken as the same standard as a face-to-face examination, specifically with regard to registration for unregistered candidates?
All of our professional examinations are approved by the GMC, even if it's on a temporary basis. But Frank, perhaps you'd like to expand on that.
I'm happy to do so. We've already had preliminary meetings with the GMC and the Association of Medical Royal Colleges. In fact, we've had meetings with all the colleges, and it's quite salutary to sit around a table and hear what the pathologists and the radiologists and the emergency medicine people are planning to do, the gynecologists and so on. And the GMC are very largely sympathetic and have a fast track approval service going into place as we speak. We've had preliminary conversations about what would be acceptable and what wouldn't be acceptable. From our point of view, and the candidates will understand this, it's important that we have an exam that is reliable, that is valid, and that is acceptable to candidates. In other words, has face validity. And part of our any rejigging or any alternative plans that we have been very carefully scrutinised by our statisticians across the Royal Colleges to make sure that they retain validity and reliability, and that we won't be dealing with exams of different standards. So I think the bottom line is, in answer to that question, the GMC are keen to help and approve. They understand how all the colleges are dealing with different resources. There is a fast track approval process in place should we have to resort to an alternative style, in other words, a remote examination. And our hope would be, having put through changes to the MRCS over the last couple of years and being familiar with the process, that we'd get it right. I can say that Dr. Landau happens to sit on the GMC clinical advisory group, so has some insider knowledge of what's involved. This isn't a completely different role that he plays, but so perhaps you just quickly like to chip in there as well, Alex, and say what the GMC does and how it looks at it.
Yeah, so I think the GMC they've identified the fact that these circumstances are really unusual, and I think that there's much more flexibility around not what might be approvable, but certainly the timeframes involved. And I think that it's incumbent upon the colleges to demonstrate that they can show the GMC that the way in which candidates are being examined and the standard against which candidates are being examined hasn't been diminished by any changes that will be made. So there might be submissions from some colleges regarding streamlining circuits or removing elements from existing circuits that are much harder to assess in a remote context, for example. It will be contingent upon those colleges to demonstrate how that assessment could reasonably take place in other contexts. That might be through workplace-based assessments. It might be through assessments in other sort of non-contemporaneous contexts. So we've talked a little bit in general terms about how we might assess practical procedural skills in the context of the MRCS Part B. So that's quite a salient consideration for us, or it will be in the fullness of time. So I think the GMC have identified a set of really specific principles for colleges that are pertinent to the situation we're in, and I think they can ensure that they can apply those principles to provide fairly quick turnarounds for colleges to ensure that to revised formats can be improved and the communication of those formats can be expedited.
Thank you.
So I have a question about the Part 2 FRCS in orthopedics. When will places for the November Part 2 be confirmed, irrespective of the format?
That I don't know. Sorry, I can't answer that one.
Okay. So a question from a Part B candidate specifically, but this might be applicable to lots of different candidates more generally. if my exam in the spring was cancelled and I'm not a trainee, do I need to reapply for the next exam sitting, or will my place automatically be transferred over to the next available sitting for me?
Alex, perhaps you could answer that question.
Okay, I can answer that one. So there's no need to reapply for any exam if you've already applied. If you're allocated a place in the next sitting through the prioritization system, that will happen automatically. If you don't have a place at the next sitting, the same principle will apply. Your seat, as it were, will be there for you as soon as we can accommodate you. So you don't have to do anything further. We will keep all candidates as updated as frequently as possible in terms of the current status of their application. So we've probably got time for one more question now, because we're coming up to 7 o'clock. One hasn't been answered. So will candidates be able to progress through to ST3 if you have had the May MRCS Part B postponed? So you're looking to set the May MRCS Part B, you needed to pass that to progress to ST3. Will you be able to do so?
If you're a run-through trainee and everything else, all else being equal, all your other competencies are on track, then you will be allowed to progress to ST3, but you must pass the exam in the next year before you progress to ST4. If you are a CT2, a non-run-through trainee, we've already had national selection, you would needed to have passed the MRCS because it is a requirement for the selection process. I think that answers the question. Okay, thank you. Ms. Myint, do you have any final words in terms of a summary? Well, I have to say, I'd like to thank the panel, Josh, Tricia, and Frank. Thank you very much for your contribution. Would any of you like to say anything burning before I sum up? Josh?
I think.
Tricia?
Sorry,
okay, go for it. Go for it. Tricia, go for it.
I'd just like to reassure my trainees that as soon as we have information, we'll give you that information, because I know it all seems a little bit vague, but as soon as we know, we will let you know.
Thank you. Josh?
Yeah, thanks a lot for the invite to be on the panel. Just to, I guess, reiterate what Tricia said, a lot of the plans are still up in the air a little bit, particularly with the FRCS, and I'd anticipate that that guidance will be put in writing to those candidates who are expected to sit it in the next sitting. So watch this space in terms of communications. And thank you to both the ICBSE and the JCA for continuing to include us in these conversations.
Thank you. Frank?
It's just a little comment, really. I think to all of the people who are attending today, don't get distracted by the mechanics of what's going on here. It's going to be the same examination covering the same material. You're still going to have to revise. It's very difficult to get flustered by everything that's going on. So take time, get some quiet headspace, sit down, do the revision that's necessary, and we very much look forward to welcome you as both members and fellows to, in fact, all the 4 Royal Colleges. But thank you to the Royal College of Surgeons of England for hosting this tonight.
So just to sum up, and thank you, Alex, as well, for your always wise knowledge. So thank you very much, everybody, for listening today. I'm sorry we couldn't answer all your questions, but actually, hopefully some of the questions you have asked will inform where we go from here. So you're contributing also to the process. As everyone has said, we'll try and keep you as informed as we can. The examinations are there to help you progress. We're just not here as ogres trying to be horrible to you. We'd like to support you in this. If you have any further questions, do let us know. We've given you the relevant email addresses, and we'll try and answer them as best we can, as and when the answers become apparent. So thank you very much. And just to sum up, just to finish, of course, this webinar is part of a series, and you'll see on your screens now that next week's webinar is on parenthood and the pandemic, two of our council members, Scarlett McNally and Victoria Pegner, followed by Innovation and the Future of Surgery, hosted by Richard Carr, as you know, who ran the Future of Surgery project for the College of Surgeons of England. Final slide, please. Misha? There's another slide. Is Misha gone? Don't worry, thank you. So, as a final, thank you very much to all the panel and to all of you who are participating. We'll do our level best to keep exams on the right track and in support of all the trainees. Thank you very much. I'd like to end the webinar.